why sperm motility matters more than sperm count, right? Why the swimmers? Yesterday, a lot of things were said yesterday. The video will drop tonight, but you want to catch up on YouTube. You will not miss anything, right? Okay, so let's begin. We'll not wait for anybody. Anybody coming late? We'll have to go to YouTube. So if you ask most men what determines fertility, just take a random sample, ask men, what determines fertility? The answer you will hear almost every time will be sperm count, sperm count, sperm count, right? and, and you will not blame them for that because people assume the higher the number of sperm, the higher the chances of pregnancy. I'm sure that's what we all have been told, right? But again, let me give you some little more insight because reproductive biology will tell you more about this story. And that's why tonight, you got to sit tight, grab a pen and paper. We're going to tell you the whole story in details. Are we ready? Are we ready? Right? If you're ready, please type in the comment section ready so that we'll know that you're there. Right. Are we ready for tonight? Okay. All right. In many real world fertility cases that we see, right? Motility means how sperm moves. That Ivy is here. Hello, Ivy. Good to see you. Martha is here. Wow, good to see you. All right, we're ready. The network is so slow, but I'm sure you can hear me. The hearing is more important. If you miss anything, go to YouTube, right? So I was saying that in many real life cases that we see almost all the time, motility, I was going to explain that motility is how sperm move, right? And I've always said that the tendency for sperm is to move forward, right? It's not just to move because some people are moving, but they're not moving anywhere, right? So how sperm move matters more than how many sperm are present as far as biology is concerned, right? Because a man can have millions of sperm, right, and still struggle with fertility if those sperm that there is cannot move efficiently towards the egg. The problem with the egg, good evening, Melon. Melon, good to see you. You're welcome. The problem with the egg is the same problem we have with women even today, right? What's the problem with egg? The egg, when it's ovulated, it does not go looking for nobody. It just moves down into the fallopian tube, stop halfway, and start making up, putting all the lipstick, the eyelashes, that thing that extended forward, right? And you just be there, fanning herself, waiting for all those millions of sperm to hustle to come and meet her, right? Doesn't that sound like some people we know in this world? So, like I said, egg behaves like women, right? They just have the same behavior. So, okay, how did I get there? I was going to say that a man can have millions of sperm and still struggle with fertility if those sperm cannot move efficiently towards the egg. The egg will just sit at one place and remain there and wait for the sperm to swim towards her, right? So we need efficient swimmers, not just machos who are roaming all over the place, right? No, you cannot start asking questions now. You've not learned anything. You've got to learn first before you ask questions, right? Is that okay? So wait, after I'm done, then you can ask questions, regardless of where you want to pick your questions, whether today or whichever concern you have. Is that okay? So, right? So now the understanding this concept is very crucial for couples that are trying to conceive, and also for professionals that are going to interpret the semen analysis result, right? It's very crucial. Now, last year I did a very extensive discussion on the journey of sperm towards the egg, but I'm not going to do that this year. But I'm going to give you enough information that will help you, right? So, just an abridged version. I want to give you the abridged version of Mrs. Wisdom. Thank you for the follow. I'll give you the abridged version of the journey of sperm, or the journey that sperm must survive. I tell you, if you know that, you pity sperm, right? You pity them. You pity them. What they had to go through just to meet that egg who will still do shakara. Can you imagine? Right? So, to understand why motility is more important. Now, I want you to imagine the journey that sperm has to travel. Think about it. After ejaculation, thank you for the heart, me. I appreciate you. After ejaculation, right? Ejaculation is when the man produce the semen, right? The semen is the packaging for the sperm. All right. So after ejaculation, the sperm will be deposited in the vagina. Yeah. And I've said that the vagina in itself is hostile to the sperm. It is. But let's hold on first. Hold on first. So the the semen is expected to deliver the sperm to the vagina, right? So from there, the sperm must now travel. It has to move through the cervix. It has to move through the uterus. It has to swim through that cavity, and it has to reach the egg within a limited window. Why? Because we know that after ovulation, egg lasts 12 to 24 hours, after which it will no longer be available. All right? So within this 12 to 24 hours of the egg being available, sperm cells have to travel from the vagina through the cervix into the uterine cavity, then find its way to the fallopian tube. There's no telling the kind of hurdle they have to face. I'm going to explain that hurdle tonight, right? Maya is here. Hello, Maya. This journey that they have to travel is long and hostile. There's no telling what they had to go through, but I'm going to tell you tonight what they had to go through. Oh boy, if you know what they had to go through, you will pity sperm. Now you know why they have to be plenty. Because in the end, only one that is needed. It's kind of sad. That's really sad. All right. Understand that the female reproductive tract is not just like an open tunnel. It's not that way. It contains immune defenses. There are immune cells that are there. The tract also has mucous barrier, right? And even in that tract, there are pathways, directional pathways, because we have two fallopian tubes. So you need smart sperm cells to know this route and locate where the egg is. Is that not interesting? It will blow your mind what we had to go through to become human beings, right? And of all in this journey of millions, it has to take only the strongest sperm to survive, because that journey is a very hostile journey. I will tell you why it's a hostile journey. Because even in healthy men, if a man is healthy, remember precious sperm? Yeah, if you're here, you know what I'm talking about. Crownberry, I see you, you're welcome. Right? So I was saying that even in healthy men that produce precious sperm, only tiny fraction of sperm will ever reach the egg. Why? What happened to the millions? You'll be amazed what happened. I'm going to tell you. Right? You need my number, Crownberry. Okay, just send a DM. Right? Send a DM. So, fertility does not depend on how many sperm starts the race. Now, it doesn't matter. It's just like marathon, right? It doesn't matter how many cells start the race. It depends on how many successfully swim through the journey. It's not how many started, right? So you can have hundreds of millions of sperm cells. That will really not matter. What will matter is how many can swim in those hundreds of millions, right? So now, before I think I should, okay, let me give us an idea what happens. I did this extensively last year. Okay, let me do the abridged version. Now, this is what happens. Let me start with the female, right? Now, the baby girl, that from the day, in fact, from the womb, the baby girl has all the eggs she will ever have in her lifetime. That's the reason why, as she grow older, the number of eggs reduce. Also, quality eventually. So women don't produce eggs like men produce sperm. Now, that is settled. Going to men, for one sperm cell to be produced, or rather to be ready for the race, it takes 74 days from the time the cell was produced to when it is matured and stored. Right? Now that will mean that you need more than 3 months to prepare quality sperm cell, right? All right. Oh boy, I'm just thinking about those guys that have precious sperm. Don't give it to everybody. Make sure you select the right person to give, right? Now, when the sperm is ready and you are doing the do according to my person, what's her name? Maya. Her name is Maya today. When you do the do narcology, what happens? The sperm cell, the sperm rather, will be moved from its store. I will not go into all those details. Moved from its store. Then there are packaging centers where all those things you see with your eyes, the milky appearance, the whitish appearance, the thick um, molten consistency, all that will be added to it, right, to nourish it and to protect it for delivery. Now, that will be delivered. And by the way, all that contains a lot of minerals, a lot of vitamins, a lot of enzymes and stuff. So even if pregnancy no take place, your body still enjoy something. You just answered what's been on my mind. Okay, it's good. Right? So, see how rich this thing is. So, when it is delivered to the vagina, after a few minutes, the enzymes in it begin to break down. Of course, that's enjoyment without result. So that's why I encourage people, just make sure you keep knocking. Don't relent. Just that's why you see some women, they robust. All right. So after some minutes after ejaculation, the enzymes in the semen begin to break down that thick consistency right? Break down the thick consistency. Why? Because in that thickness, sperm cells cannot swim. It has to break it down and make it fluid like, water like, so that the sperm will be released to swim. It's like on your mark, set, go, right? So basically, that's what happens. Now, that is the first encounter. But again, the vagina is acidic. A lot of the sperm cells there will die because of the acidic nature of the vagina. Then the ones that survive that harsh conditions. However, there are also compounds that help to neutralize or to reduce the acidity for their survival, but still many will still die there. Now, those that survive the vagina will have to face the cervix. The cervix has mucus. Mucus. That's where this vaginal discharge comes from, right? Or the vaginal discharge that you know, it comes from the cervix. Now, during ovulation, the consistency of the vaginal mucus is loose, clear, stretchy, egg white kind of consistency. And that permits good swimmers to pass through, but the weak swimmers will be trapped. Is that okay? So when they get trapped, those ones, their journey has ended. But the good swimmers, we wriggle their way through that mucus. That is hurdle number 2. The mucus, trapping them, holding them in. So it's only the fittest that will survive. When they survive the cervix, and by the way, the cervix is not just one space, it has some distance. So when they survive that hurdle, the next phase of hurdle is the uterus proper, the uterine cavity. The problem with the uterine cavity is that there are immune cells, defense system there. Because the sperm does not have the same DNA with the woman that produced the immune cells, the immune cells will attack the sperm. So there's going to be a lot of kidnapping and unaliving in the uterine cavity, right? Catch and kill, because it's considering it to be invaders. But again, there are many. How many will the immune system want to trap and kill? So the fastest we swim through that onslaught. By the time Christy LaBelle is here, right? So by the time the sperm cells get to the fallopian tube, they would have remained just a few hundreds, maybe anywhere 300 to 200 remaining of the millions of cells. Let's assume we're taking the lowest benchmark of 40 million, right? Now, just few hundred. What happened? Several died on the way in these hurdles I just mentioned. There is a vaginal hurdle, there is a cervix hurdle, there is a uterine cavity hurdle. Now, they are faced with another last one. That's not the last, but more like another tunnel, right? And that is the fallopian tube. The fallopian tube contains a lot of finger-like structures that are constantly moving against the direction that the sperm is coming from. So you still need stronger swimmers to go against the tide towards the egg. But again, before we get to that point, how would the sperm know which of this fallopian tube lies the egg? How would the sperm know? Now, this is where another shakara comes. The egg will release scent. Remember I told you the egg after ovulation will be making up, putting all that, putting deodorant and stuff. So that scent goes towards the uterine cavity. It is only selected sperm cells that can perceive that scent. And they will know the direction and which tunnel to follow to meet the. Is that not wonderful? Right? It's just amazing what's going on. Then the ones who did not may either go the right way or go the wrong way, right? They may go the right way or they may go the wrong way. Now, if they get to the fallopian tube and are able to survive, while they are actually surviving it, what they are doing, they are changing their clothing. After going through all those hurdles, a man of war will not go to the princess with armor. No, he has to remove his armor and wear his full regalia of royalty, right? So, hey, Chef Elsie is here. Good to see you. You're welcome. Welcome in. Good evening, Phoenix in Omotala. Good to see you. Right? So when the sperm gets to the fallopian tube and is surviving the tide, because the tide is always against the sperm, it changes his armor and put on full royal regalia before it gets to the egg. And yet, among the few that gets there, only one will successfully penetrate the wall of that egg. Then fertilization takes place, right? So these are all the things that sperm had to go through. So even though the number is good, you can now see why we need the numbers, because of the onslaught they have to face. But again, even in the numbers, it's only the best swimmers that will get to the egg, right? So now, let us look at what motility itself. Motility, I told you before, is the sperm ability to move. So let's look at what that means. What it actually means. What does it mean, right? What does it mean? What does it really mean? If you're just joining, you're welcome. Please share the live. There are people who need this information that I'm sure which will change their fertility story. So you want to share the live, tap on your screen and give more people opportunity to come in, right? All right. Thank you for the follow. Olga Pro, good to see you. And by the way, if you know any man, okay, you should send the link to all the men you know, because this is a men gist. Even though I know men rarely will be available for this gist, but we'll continue to gist it until they hear, right? Now, what motility actually means, right? Good evening, Olga Pro. I see you. Now, motility refers to the ability of sperm to move efficiently. Ability of sperm to move efficiently is what motility is. So when they give you that your semen analysis results and you see motility, that's what it's talking about. The ability of sperm to move efficiently, right? So in the analysis, the motility is going to be categorized into several types, right? So for those of you who have done semen analysis before, you already know what I'm talking about, because you're going to see something like progressive motility and non-progressive motility, right? So what does progressive motility mean? It means that the sperm move forward in a straight or slightly curved pattern. It's moving. That's what progressive motility is. Moving forward, right? It's moving forward. They are the capable ones that can reach the egg. So that's what we really want to see. We want to see those ones that are capable. So you are looking at the value. How many of them have the capability to reach the egg? How many of them are lagging behind? That's where non-progressives are. Non-progressive means that they are moving actually, right? They are moving. Have you been in some area where they say no loitering here? Have you been in such places? Ni Michelle, I see you. You're welcome. Have you been in such places? They say no loitering here, right? Because these sperm move, but they don't advance effectively. Remember, the tendency for sperm is to move forward. So we don't want loiters. just moving all over the place, moving all over the place. You are not moving forward. No, that is what non-progressive motility means, because they may just be vibrating in one place, or it may just be rotating, right, in a particular area of the slide, or they may be moving in circular motion. That's not, what kind of sperm is that? I consider them loitering. They are not moving forward. So you also look at the figure. How many are they? How many are they? Now, after you have established the total count of sperm, which is good. A lot of people, when they go to sperm count and they see it's above the lower limit, they say, "Hey, nothing is wrong with me. Oga, calm down." There's more to look at. Right? So you're going to be looking at motility and the two types of motility, the progressive and the non-progressive, right? Then also we look at the ones that are immotile. That is the ones that are not moving. Immotile sperm. They don't move at all. They're just there. They're not going anywhere. Anyway, those ones we already know where they belong. They're certainly not going to fertilize nothing because they are not ready to move forward, right? They're not going anywhere. But in fertility, only the progressive sperm will meaningfully contribute to fertility, right? Only the progressive sperm will contribute. Now, and of course, when you do your semen analysis, you see the reference by the side, so you want to look at it. I'm just giving you some information so that you understand how to read it, right? So, is the number of counts more important than the swimmers? So let's look at why the swimmers are more important than the counts, right? So let's consider a hypothetical situation. Two hypothetical situation of semen results. Let's think of man A and man B, right? Now, man A has a sperm count. 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 In other words, when they count the sperm per meal, right? What we were able to get was like 18 million sperm cells in one meal, right? And motility, remember what motility is, I will not repeat it again, is 15% of the 18 million sperm cells. The motile ones is just 15%. That is man A. Keep it at the back of your mind. Then man B, we did the sperm count and we found out he has 25 million. Good evening, T Square Edibles. Good to see you. Man B, the result comes out, we see 25 million sperm cells in one meal. And of these 25 million sperm cells, 60% are motile, right? So which man, talk to me in the comment section, which man has a higher chance of achieving pregnancy? That is the question. Well, man B has the advantage. And the reason is obvious from what we've talked about. Man B, because he has a larger proportion of his sperm that can move forward towards the egg. Man B does, right? The reason is because fertility is not about the numbers. Fertility is about the function. Once I saw a particular, I think we were doing semen analysis for a particular donor that was supposed to donate for some stuff, right? I think the guy is about 30 years of age, I think. He's got zero motile cells. All the cells are dead. Why? What happened? Right? So even if the sperm count is within the range, but there's no motile cells, all are dead. That can never achieve any pregnancy. So the amount of swimmers is more important than the population because we need those who will move forward. We need those who will move forward. AJ Praise is here. You're welcome. Now, when you meet your clinician, they will definitely be doing some calculation for you. But these are the things, parameters that they are going to look at basically. They'll just combine it. They'll look at semen volume. They'll look at sperm concentration, that is amount of sperm in the semen. Then the amount of the percentage that are forward moving, right? So all those calculations will be done and they will advise you, right, on what to do. And you'll be fine, right? So just to further buttress these swimmers, how does sperm achieve this swimming ability? What is the biology behind their movement? How does it happen? I've said things about what men can do to have quality sperm, right? So I'm giving a little more details so that when you're changing your lifestyle and habit and stuff, these are the kind of things that you're doing to your sperm cell to have precious sperm, right? So sperm movement, of course, everyone knows that sperm has tail, right? Sperm movement is powered by that tail, and it's just moving like this to propel the cell forward. And it requires a lot of energy to do that, right? Now, if there is a failure in the provision of energy for the tail to move, it means that motility will decline, and that will mean that fertilization will fail. They will not be able to fertilize nothing. But you want to think of it like a car, right? The engine will exist, yes. But if the fuel system or the what they call the transmission fails, what happens? The car cannot move to its destination. So that's what the tail does for the sperm, right? And what can affect it? Your lifestyle affect it. So one of the things that will go to YouTube, the details are there. All right, we've talked about it before. So most of those your lifestyle behaviors that is affecting your sperm cell ability to move forward, change it, and in 3 months, I can guarantee you that you have quality precious sperm to present. Right. Now, what can cause poor movement for those who are just joining us? Thank you for the follow, Candy Crush. I see you. What can cause poor movement of sperm? Yesterday we talked about watery sperm and all those kind of sperm. Yeah, 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 yeah. If you miss it, go to YouTube because I'm not going to repeat it. But just a quick one for the cause of poor sperm movement. What can cause sperm not to move? What are the factors that can reduce the movement of sperm? Some of those factors are actually medical causes, but the one I want us to focus on because it's in your hand is the lifestyle related cause, right? And the common causes of of um, of motility reduction as per lifestyle will include varicocele, right? Oxidative stress, where there is excess free radicals that will damage the sperm cells, thereby reducing its movement. Infection. Who does not care about infection in both gender? It's men. They don't care. They just feel like, listen, we'll go one day. So infection. right, can cause and interfere with the movement of sperm cell. Hormonal imbalance also. It's not only women that have hormonal imbalance. Men have hormonal imbalance. Why? Because you can have low testosterone, or you can have disrupted hormonal signals, and all these can affect sperm development. And anything that affects sperm development will affect the way and its ability to fertilize egg. There's also the genetic cause, right? There's a genetic cause. It's rare though. It's rare to have structural defects uh, because of that, right? And when there is that kind of damage, it also reduces the normal movement of sperm, right? So the lifestyle I was mentioning earlier, because this one is in your hands, and I want you to be able to deal with the ones that you can do. Leave the doctor and God to solve the remaining ones for you, right? So, and the one you can do is lifestyle factors that quietly reduce your sperm motility. What behavior, what kind of life are you living that is reducing the ability for your sperm to move? We're talking about producing precious sperm, right? So, what kind of lifestyle are you living that is causing this problem? Because everyday habits can significantly reduce the movement. Example: smoking. Smoking. Because when you smoke, what happens is you are introducing toxin into your system that can damage sperm membrane. You may feel high, but it's just for a moment. The toxin for that cigar or whatever you're smoking will damage sperm membrane, and therefore you have low quality sperm. Low quality sperm means that they cannot move forward, right? There is excessive alcohol issue, because excessive alcohol will interfere with hormonal balance. It will interfere with hormonal balance. So what do you want to do? You cut down on your alcohol, because it's difficult to tell people to stop. But cut it down, right? And you'll be fine. There's also the aspect of obesity. There's the aspect of obesity. Obesity increases oxidative stress, and it's two things it does: increases oxidative stress and testicular heat. The heat part, you cannot compromise it. Oxidative stress, you should even make sure you look into that business seriously. So what do you want to do? You cut down your weight. What is your BMI? I've asked this question several times on the live stream. What is your BMI? Go and check your BMI. It's not enough. It's not only people that are vast in their body that are overweight. Some of them they are not even overweight anyway, right? So it's not just people, just those people. It's actually a question of what is your weight against your height, right? Uh-huh. Do you have a proportionate weight to your height? That is what we mean by BMI. Then those people who hate to sleep. I'm talking to all of us that are doing TikTok, especially. You hate to sleep. You're always at night, right? So because I'm talking about men, I'll stay there. I will get to women later, right? Poor sleep affects testosterone production. And I'll say it over and over again. Men reset. Thank you. Mr. Embassy is here. Thank you very much, Mr. Embassy. Thank you very much. I appreciate you. Thank you for coming. Poor sleep. Poor sleep affects testosterone and sperm production. All right. And I've said it that men have a 24-hour cycle, women have 1 month cycle, 28 days actually. 28 days is 1 month. Forget that 30, 31, right? 28-day cycle. right? So men recalibrate every day, every day, every day. And how do you know that? But then you go to sleep. That's 7 hours, 8 hours that you're sleeping. What happens? There is a house cleaning job that is going on. Mom was of course man must work. But you have to weigh which one do you want for the now? You want kids or you want work? So find a balance and you should be able to get results. Right? So when you sleep, housekeeping job happens in your body. Dead cells are removed. Weak cells are removed. Cells that are misbehaving, especially those ones that want to become cancer, they will be removed. Right? Then your hormones will be recalibrated, especially testosterone. And that is why every time you sleep as a man, every healthy man would have noticed one thing. Early in the morning, there's always your John Thomas is always like this. There's erection. Every healthy man, whether he's a child, whether he's a middle age, whether he's older man, John Thomas is always erect. Right? You know, I heard the story of a very religious woman. Right? I will not speak of the denomination. Right? Very religious woman. They just got married. So on this day, she woke up from sleep and noticed her husband's John Thomas standing up like this, fully charged, right? Then she woke up the guy. Wake up, wake up, wake up. Let us pray, let us pray, let us pray, let us pray, let us pray. Oh God. Right? And now they were busy binding and casting devils that did not exist. Is that not ridiculous? Hi, Bunnies. Good to see you. Who binds demon of erection? You should be glad that there is a demon called erection, right? Who binds it? Because it must always happen every morning for a healthy man. It means that his system has rebooted, ready for action. Then as he goes through his day full of energy in the morning, then by midday, the testosterone level begins to crash. Right? I like you. You are too much. Exactly. Because that is the peak of testosterone levels. So if you are smart, take advantage of that time. You're right? Like, I feel sorry for some of you you think you'll be young forever. Continue. You will not be young forever. Take advantage of it. Anyway, where was I? So as he goes through his day, by mid-afternoon, testosterone level begins to decline. So energy, tenacity reduces. Then he comes back from work. He wants to go back to sleep. Woman, if you are smart, allow him sleep. Let him recalibrate. Because when he recalibrates, firing will be easier, right? Stop looking at me like that, as though you don't know what I'm talking about. All right. So I said that to portray the fact that when you have poor sleep, it affects testosterone production. When it's good time, today is the good time, right? Now is the good time, so don't wait. Finesse, you say you don't know. That's why you pay me, right? The unmarried are jealous. No, don't be jealous. Just be knowledgeable, so that you don't go and be binding and casting devil of erection. If there's anything, you should welcome that devil. Say, that devil, locate my house, right? Sleep well. Have quality sleep. Have quality sleep. Have quality sleep. Because when you sleep well, your testosterone level goes up and erection will not be a problem. Don't take any enhancement. Don't take any drug. Don't take any concoction for erection in your lifetime. Don't do it. Why? Because when it comes to sexual intercourse, you are not born to please anybody. If you are a 2 minutes man, be a perfect gentleman in your 2 minutes, right? If you are a 1 hour man, be an excellent 1 hour man, right? Don't go and kill yourself. Oh. Yeah, that's a good question, Sandra. That's a very good question. Why? Because as you grow older, the quality and possibility of getting pregnant reduces. Yeah, that's the reason, right? So never use any drug to enhance erection. All you need is to go and sleep, eat well, change your lifestyle, and you are good, right? Why? Because chronic stress elevates cortisol. Thank you very much for the heart me. Time to tell story. Good to see you. You're welcome. Chronic stress increase cortisol, which can indirectly reduce or affect reproductive hormone. Yes, drink water well. Be well hydrated. Chronic stress. When I get to women, I'm going to tell you what this poor sleep, stress, and all these things does. But I'm talking to men. So that because I want more John Thomases to be standing up in the morning, right? And you better take advantage of it. Right? Yeah. And there's also the issue of exposure of heat to heat, right? You should not expose your scrotum to too much heat, please. It's going to affect testosterone level and sperm production. Please don't do hot baths. You sit down in your bath saunas. You say they enjoy. You're just you're cooking your balls, right? Don't put laptops on your laps. It's not for you. Leave it for women. Even the women say they shouldn't do that, but then don't do it because you are overheating that area, and it's not good for sperm production, right? What did we discover the other day? 50% of um, of male reproduction across the world has been dropping, right? Male reproduction ability to produce sperm has been dropping in the past 10 years by 50%. That is a big deal. What is happening to our men? More of them are now techs. They are sitting on their laptop, right? Sitting all day long. You don't know that when you sit for too long, your balls will be cooked. You think, I don't know why my live stream is not long. My live stream is just 1 hour, 30 minutes. Because I don't want to cook my balls. Right? You'll be doing yourself harm. You can't sit down for a very long time. Right? You can't do that. So you don't want to put laptops on even phones in your pocket. It's not wise. Right? Why? Because all this will increase heat, and the heat will reduce motility. My network is so terrible. Something is on my screen. I don't know what to do about it. But if you're making comments, just keep making comments. I'll see it when this thing goes away. Right? So I said all that to say the testis functions best in temperatures that are 2 to 3 degrees less than the normal body temperature. So if the normal body temperature is 37 degrees, just minus 2 to 3 degrees out of it. So that is what the testes need to produce quality sperm. So you want to do all these things I'm mentioning for the past few days about male infertility. You want to do that for 3 to 6 months. Your sperm will be very precious. I tell you, that's how to produce precious sperm. That's how to produce precious sperm. Because if you give yourself enough air around there, eat well, sleep well, manage your stress, good exercise, stop smoking, reduce alcohol. Do this for 3 to 6 months. When you produce that thing, it will not only lead to a baby, it will make the woman look fresh and I don't give her too much expo. Oh boy. All right. So I'm waiting for this thing to leave my screen. Right? I'm waiting for it. So moving forward, is my network is so slow. It's so slow. There's so much going on my screen. All right. But if you can still hear me, just enjoy what I'm saying. Now, when motility is low, that is when the sperm is finding it difficult a lot of them are finding it difficult to move forward. What your doctor or your fertility expert will recommend for you, they will recommend IUI. You know what IUI is? IUI means intrauterine insemination, right? So the motile sperm, the ones that are forward moving, will be concentrated. In other words, they will separate the wheat from the chaff, and place it directly into the uterus, so that those ones can travel effectively. They will bypass the vagina, bypass the cervix, bypass the immune attack in the uterus. Put it close to the fallopian tube so that they can run and fertilize. A lot of people have enjoyed this success, right? So if that is your case, you want to take advantage of it, and I'm advising you now, right? I'm advising you, take advantage of it, and you will be glad you did. So that is for IUI. Then you can also consider IVF. Like I always say, most people are wasting their time. Go and get evaluated so that you know if natural conception is not working for you, right? Go and get assisted reproductive technology.